in July, for me, that's when my mother also got COVID, and I live with my mother. She's a nursing sister at Bheki Mlangeni, which is one of our referral hospitals. So she got COVID, and for the first time I felt what isolation was. So in the house, it's myself, her, and my daughter and the helper. So now there was an issue of my mom's got COVID, she has symptoms, it's been 2 days. We know that 2 of her colleagues have tested positive. And we're panicking, waiting for the results, but we know that she's probably going to be positive. And my daughter always goes to my mother's room. On her way to go to bed, she always goes to my mother's room. So once my mom was isolated for the 14 days, and the guidelines at the time were still 14 days, it was the worst 14 days of our lives, because my daughter would walk past the door. Why is it closed? She would, bang on the door wanting to go in, but we couldn't let her in. Then there was her being in the room and feeling isolated. And at times with the joint pains and the body pains, she would be like, but now who's gonna rub my back, or, and I mean, now we sit back and we laugh about it, but back then it was stressful. We had to go to a casualty several times with shortness of breath or just difficulty with body pains. And even then, just driving my mother to casualty was scary, because now I'm in the car, I'm in a close space with her. Yes, I'm wearing a mask, she's wearing a mask, but we know that it's not 100% proof that you won't get COVID. There are people who are strict about wearing their mask and washing their hands who did get COVID, right? So July was a month that we want to forget about in my house, because it was a bad month because my mother was isolated for 14 days. But when she came out, I became more aware of certain things that patients complain about in the ward. So the body pains, the difficulty breathing, but the SATs are okay. We monitor the SATs with this finger thing. And you look at the SATs and you think, why is this patient complaining? But also you get to see how you can help your patient getting the phlegm out. How important it is to tell them to lie on their tummy. How important it is for them to keep warm and to take those warm drinks, and to cough up this thing that they're feeling in the chest. And when they say that they can't breathe, they really can't, they feel like they can't breathe. So for me, it opened up my eyes from taking what's in the books, and when it happens in real life, that it's 2 totally different worlds. The books help you to manage patients, but when it comes to your house, it's a completely different thing. The isolation that COVID patients feel. So you're sick, you're feeling unwell, you've got body pains, but you've got no one to really talk to. You're cut off from your family. So it's even worse when you're in hospital. So we were fortunate because my mom was isolating at home, which was different to patients who are stuck in hospital. The use of cell phone and video calling became such a treasure. And I tell patients now in maternity, if you've got a smartphone, make sure you take your charger when you get admitted, because you're going to want to video call and see your family members, because they can't come here, they can't come to the hospital.